don't want to normalize this, but I want to say that many of us are having a normal experience to very abnormal circumstances. And really, older adults, while they're extremely resilient, they are kind of, many of them feel like they've got a target on their back. Okay. They are definitely at greater risk. And we are anticipating great risk for the psychological fallout of the pandemic. And for a couple of different reasons. But one of the big reasons is if you work with older adults, you probably already know that they are, they tend to be a group of people that are resilient and want to do things for themselves, independent, and they may not articulate the distress that they're going through, or they may use different language when they're talking about mental health issues because they weren't raised to talk about mental health the way that we talk about it these days. So I'm sure that a lot of you are really good at listening to those kind of coded words where somebody might say they're feeling blue. And I want you to really tune into those kinds of things because we might need to talk a little bit more differently and honestly and openly with an older person who's experiencing a mental health problem. We also know that because of their risk factors, and I'm going to go into a lot of the risk factors, that we need to just be proactive. All right. We should make the assumption that for actually everybody that we're dealing with, we we should have that radar up. Okay. We should be proactive in talking with people openly about the importance of mental wellness. And that's different than talking about the distress of mental illness. Most people are not going to identify as having a mental illness, but let me tell you, in a normal world, 1 in 5 Americans meets the criteria for a mental health disorder in any given year. And for older adults, that number is even higher because of the physical issues, the medications that they're taking, a lot of things that we'll talk about that elevate their risk for having a mental health disorder. So all of us talk about mental wellness, and you all are in a very unique position to do that. You're with family members, you're with older adults, you're with their care partners, and you have an opportunity to be a liaison, an ambassador, if you will, for mental wellness and for some of the resources that I'm going to give you today. And it is probably one of your most important jobs is to be part of the anti-stigma around behavioral health issues. I'm going to talk about behavioral health in a minute. I don't want to get ahead of myself, so let me talk about Rose here, which is just a picture. I pull a bunch of pictures off of Google, so if this is being recorded, I could get in a lot of trouble. But nonetheless, I look at this woman who looks so much like my grandmother and know that the last thing that she might think is at the age of 90 something, she might develop a mental illness or a substance use disorder when she hasn't had that kind of issue in her past. And for most older people who are experiencing a mental health disorder or a substance use disorder, they came into it accidentally. This is something that they weren't necessarily vigilant that they were experiencing the risk factors, nor do they see the signs and symptoms as something that is of a mental health problem because it's so easy to ascribe to other issues. But what I want to do with this slide is talk about Maslow's hierarchy of needs. And for those of you who took psychology in school, this will be a revisit of this very accepted theory that for anybody to realize their full potential, to really what we call self-actualize, there are building blocks that need to be in place. And it makes a lot of sense. So if you start at the bottom, our physiological and safety needs must be met before we can build on relationship before we can feel a sense of security and confidence and self-esteem, before we can really pursue those kinds of things that are going to be meaningful to us in our life. And so what we have looked at developmentally for kids especially is how, when you're a baby and you learn that your basic needs are going to be tended to, somebody's going to keep you warm, somebody's going to bring you food, somebody's going to keep you safe, you have a family, you start to learn about love. And because of that, you can start to feel really good about yourself. And hopefully that continues throughout life so that people can really reach their maximum potential. Now, I don't want to insinuate at all that aging is a downhill process. I don't believe that it is, but I can tell you that there are lots of experiences that come along in later life that can poke holes into this theory of Maslow's, where you are building yourself up. Because as you know, it doesn't take much for maybe an older person to fall down, have a bone break, be in the hospital, and suddenly be completely rethinking their safety, their security. If you fall down and you break a leg in your 30s, there's a lot of expectation that you will rehab, and maybe next year you'll be running in a race again. And that's just not the experience for people who are older, who have compounded experiences, usually compounded experiences that can poke holes into their self-esteem, into their feeling like they're living their fullest life. So I wanted to make you aware of this because I think this is a good visual to help us when we're talking with other folks about it. It's not about people sliding downhill. It's about the fact that there are lots of experience that we should anticipate as part of normal aging, that we need to build some bridges for. All right, we should look at our job maybe as helping to plug up some of these holes, or at least helping people transcend some of the challenges that we can expect in later life. Now, I'm going to use the term behavioral health and mental health interchangeably, and I want to explain that. We use the term behavioral health increasingly, especially in Maryland. We used to have a mental health administration in our government, and now we have a behavioral health administration. And that's an acknowledgement of the fact that there are many reasons behind our feelings, our moods, our behaviors. Some of it is mental illness, and mental health and mental wellness, excuse me. But there are other reasons too. So I wanted to give you a picture of the umbrella term behavioral health and what it encompasses. So in this term, behavioral health, we include substance use. And I deliberately took out the word disorder. Oftentimes we talk about substance use disorders. But for older adults, many of whom are on medications with side effects that are depression or anxiety or suicidal ideation or moodiness or inability to sleep. Okay, so if they're taking a medication that makes them have to get up many times at night to go to the bathroom so that they're not getting a full night's sleep, and that will impact their cognition, it will impact their mood. And so we'll see a change in them, right? But you can track that change all the way back to that medication that prevents them from getting a good night's sleep. So I want to put substances under that umbrella. I also do need to say that older adults are among the fastest growing population in need of treatment from substance use disorders. And alcohol is the primary substance of misuse and abuse among all of us. And boy, the numbers are really scary and startling, having to do with how many people right now are developing and starting to battle with addiction that's developing because of the isolation and the changes that we are all experiencing during this pandemic. More people are turning to the use of other substances to allay the way that they're feeling. And this is a very slippery slope, especially among older adults who rarely understand that the physiological changes that they're going through in their lives and in their bodies makes them more vulnerable to the negative side effects or negative impacts of prescription medication, drugs of all kinds, and alcohol. So also under the behavioral health umbrella are the behavioral and psychiatric symptoms of dementia. That's a mouthful, but that's kind of the jargon that we use, because people who are experiencing cognitive impairment, at any level, can also be experiencing paranoia, agitation, depression. So we know, I'm sure all of you, as people who work with older adults, that dementia clearly falls under that umbrella of behavioral health because of the symptoms that go along with that disease. However, we don't have a public system in Maryland that serves individuals with dementia, and this is hugely problematic. And this is one of the areas where we have a lot of work to do in terms of public policy. All right. Then next we have brain injury. And I want to let you know that we are increasingly aware of how many older adults are sustaining brain injury. When we get older, it is natural for the fluid in our brain to diminish, for our brains to shrink overall. And what that means is you've got a brain inside of a skull that doesn't have that same level of cushion. A little kid falls down, they get up, no problem. An older adult falls down, boom, their brain can just bump up against their skull ever so slightly. All right, so we may not think about it as a brain injury, but we will see maybe some cognitive changes or some anxiety or some depression or difficulty focusing. And that's a brain injury. Too often we're thinking, oh, here comes the onset of dementia, when in fact it is a brain injury. Mental health disorders certainly fall under the umbrella. And so mental health disorders, what do I mean by that? I've named depression, I've named anxiety. There are eating disorders. There are substance use disorders actually fall into the DSM-5, which is the diagnostic manual that people use when they are assigning a code for an illness. I'm kind of getting off path and I don't want to confuse anybody, but we have the late onset mental health problems that I talked about, but we also have lots and lots of individuals who have experienced mental health problems throughout their life, who are living longer than they had before. And some of our more major mental diseases that people live with as chronic diseases through life include bipolar disorder, major depression, schizophrenia. Schizophrenia is extremely rare, but it is an illness that we know people used to die of at an earlier age. And I want to say that actually of all serious mental illnesses, unfortunately, because of the way that treatment used to be, and because of the way that people were treated, and also the self-care that people weren't necessarily giving to themselves, the life expectation of people with serious mental illness is about 15 to 20 years less than the general public. But we're getting better with that. And so what we see are people with serious mental illnesses living into their 70s and their 80s, and sometimes even into their 90s. So we need to know what those illnesses are, because we're going to increasingly see that among older adults. And then guess what? You don't have to have an illness in order to have a very difficult day, right? A very difficult week or difficult month. Stress and trauma all of us experience that, and we will all respond to it in different ways. And sometimes it can be pretty significant, if you can imagine, just even with, stressors of work. We know that job stress, that family stress right now, people who are experiencing the stress of having everybody at home, maybe not being able to leave, are risk factors and also contributors to these behavioral health problems that we're talking about. So I want to talk a little bit about signs and symptoms, especially among older adults. I I deliberately chose this picture. I love this picture. And for those of you on the phone, it's a picture of a woman playing cards who's sticking her tongue out. And I chose that picture because sometimes we, I don't want to say but it's true, let older adults get away with behaviors that we used to call them out on in younger years. It is not normal for people's behavior, their general personality to change as we get older. And that's one of the stigma and one of the myths that I think is hindering the identification of a mental health problem. So I'm hoping in this picture, this woman is just delightfully being playful. But it makes me think about my mom, who started to behave a little bit differently in her 60s and 70s. And, if people are very different from how they were in their 30s and 40s and 50s and 60s, and then their behavior and their personality and their affect is really different in their 70s and 80s, something could be going on. So we don't want to just say that she's worried because she's old, or he's angry because he's old, or agitated because they're old. No, something is going on. So the number one thing we're looking for is a change in a person. Other signs and symptoms includes pain, and I want to say for older adults experiencing mental health disorders, it is very physical. So when they are going to the doctor with headaches, with muscle tension that they can't get rid of, with stomach problems, and they can't find a reason for that, they need to be asking questions that would indicate that maybe there's a mental health issue going on. Sleep changes, changes in appetite, in weight gain or weight loss. Those are things that we're looking for signs and symptoms. Definitely mood swings. People who are having increasing challenges coping with daily activities and maybe not taking care of themselves. Depression and anxiety can also look like dementia, because people have difficulty focusing and concentrating and making decisions when they're experiencing a mental health problem. And we're not going to be able to know, right? We are not leaving this talk today as diagnosticians, is that the word? Or we just need to know that if we see signs and symptoms like these difficulties focusing, concentrating, making decisions, headaches, worry, fear, sadness, feeling overwhelmed, guilty, hopeless, or negative, challenges with relationships, withdrawal and isolation, different kinds of ideas that seem strange or grandiose compared to how the person used to be. We shouldn't be trying to figure out what it is. We should be giving them the language and the support and the encouragement so that they can let their healthcare professionals know what kinds of things are changing, the symptoms. Because when a family member goes in and says to the doctor, "Mom's just not right, she is just different, something's going on," those are not concrete enough. We need to help people with the language that would indicate that there needs to be some kind of an assessment. And we need to encourage people to take advantage of the assessments that are covered through their wellness visits through Medicare. I want to move on to physical risk factors. And I'm imagining that what you will see as you read through these physical risk factors and the social and emotional factors to come, you will notice that the people that you are working with, who are older adults and oftentimes they're caregivers too, experience a lot of these risk factors. And so it's the compounded number of these factors that I really want you to pay attention to. So the physical risk factors, I want to make sure I say them out loud for people who are on the phone, include the development of an illness or a medical condition, a lack of movement. So people may be being more sedentary, and we are certainly seeing that happening right now. People staying inside and not getting up out of the chair. And in a little while, we'll talk about why that movement is so important. Poor nutrition, poor hydration. Probably many of you know that a lot of us are walking around dehydrated. And it's normal as we get older to lose our sense of thirst or not have it as acutely as the little kids who line up at the drinking fountain. So we really need to push water because a lot of folks are dehydrated, and the result of that is some confusion, some lethargy, so forth. Sensory loss. So we know vision, especially, and hearing are things that we are more likely to lose as we get older. They're not as acute as we get older. And that can contribute to isolation and loneliness. Functional impairment, medication side effects. I cannot say enough about how many side effects there are to the medications that most older adults are prescribed. More than half of the medications prescribed to older adults have sedating side effects. And the thing is with the metabolism of older people is that we are just more vulnerable to the side effects. So as you know, those of us who have tried to lose weight, as we get older, our metabolism is just not moving the way that it does when we're young. And our brain is a metabolic organ. So the toxins in medications or any of the chemical agents that contribute to the side effects are far more likely to impact our brains as we get older. Certainly, genes, family history of any kind of behavioral health disorder, a mental illness or addiction, even if somebody has not had that problem before they were age 75, believe me, alcoholism can develop in later life. Some of the physical and health conditions that we know have a high association with depression and anxiety in later life that are common include heart disease, stroke, diabetes, cancer, arthritis, dementia, conditions that are painful. And there are a lot of conditions that can cause pain as we get older. And guess what? Just many of you may have noticed, even normal aging, we wake up and our joints aren't feeling the same way. And so what starts to happen with conditions that are painful is the anticipatory distress that one feels when they know that what they want to do causes pain. And the cortisol that is released in the body and what that does to other organs, including our brain, when we are experiencing pain, chronic pain. Other risk factors in the social realm have to do with all kinds of things that change. Perhaps moving to a new location, any kind of change in living arrangements, even if they are good changes. So a lot of people, in fact, my in-laws just moved from the house that they lived in for many, many years to live in a place that was more sensible, more suitable, and something that they actually wanted. But that meant that everything changed. That meant that they have new neighbors. They have new places where their light switches are, new capacity for their kitchens, all these kinds of things that we don't necessarily think about. But take a minute to think about the fact that when you get up at night to use the restroom or go get a drink of water, your body automatically knows where those light switches are. You automatically know where that faucet is. And when we move, all of those things change. And that can be extremely disruptive, at the same time when people are probably losing or having a huge change in their social network, in their role, in their roles within their families, but also within their communities and their identification with a job, if maybe they're retiring. Retirement is a big red flag time for some mental health changes. We also need to consider financial constraints, changes in mobility, a really red flag time for older people is if and when their driver's licenses are, well, I don't want to say if their driver's licenses are taken away. I think that's sometimes what we go to, but for the most part, for the older adults that I know, they're making choices. They don't see so well at night. They don't feel as comfortable driving. And so that just can decrease their activities, right? It all makes sense. But again, all of these things happening simultaneously is what the compounded risk factors um, concern us about. Some of the mental and emotional risk factors, I think, are obvious, loss. The themes, unfortunately, in later life around changes are often themes of loss or themes of things that people didn't choose, right? Because we don't choose to have pain in our body. We don't choose to have our good friends move away. We might be delighted that they're moving away to go live somewhere warmer or to live with a family member. Our hearts might be very happy about some of these changes, but nonetheless, they can represent loss and they can represent disempowerment. And so that ties back to what we were talking about earlier in those Maslow's hierarchies of needs, because they can peck away at our own esteem and at our own feelings of security. And then what happens is uncertainties open up. And it can be just really challenging to cope with the different and multiple changes that are happening. We know that people who can roll with the punches, kind of ride out the bumps of life, are usually doing much better than those people who have the more stoic personalities, who may not have the same resiliency and flexibility in their personality. I want to tell you, we now know that those are skills that can be developed. So that myth that people can't change when they get older, I'm realizing that earlier I said we want to look for big changes as people get older. I want to separate that out from what I'm saying here. We can learn new things as we get older. We can develop positive coping skills and resiliency skills when we may not have had them earlier in life. So that is a place I would encourage folks to put emphasis when you're talking to folks. This is really important, isolation and loneliness. I want to differentiate the two. Isolation is something that a lot of us are experiencing right now, and it is simply an objective measure of the number of people that somebody interacts with on a regular basis. All right, isolation is really just about how many people are not in your sphere of social connection. Loneliness is different. Some people can be isolated and not feel lonely. I've learned I'm one of those. And I think a lot of people, as they grow older and start to feel more comfortable with themselves, they can be by themselves and not feel lonely. But loneliness is a subjective measure that has everything to do with the level of satisfaction that somebody has with their connectivity with other people. All right. And I have a picture up here for those of you on the phone. It's a woman who is older, seemingly with family members, and they're putting a dinner together and everybody's smiling. And I want to urge all of us to be aware of how we can wear a mask of happiness and comfort and joy, when really inside we may still not be content with the level and types of connections that we're having with people. So in this picture, I want you to imagine if this woman is the older woman in the middle, might feel like she's imposing upon her family members who are having her over for dinner, or might feel like she wishes that she wasn't the only person who was older when they're having a conversation about something that she can't relate to. So you can be in a group of people and feel lonely, right? We all know that feeling. One of the things that I get concerned about is the assumption that if you move an older person who is single into a congregate setting, that suddenly they're going to have all these friends. That's not the case. Suddenly they're going to have a lot of people around them. Hopefully they can make friends, but we might need to help nurture those kinds of connections so that friendships develop and we don't just see that people are surrounded by other people and make assumptions that that's what they want or that that's okay. I wanted to show you a picture of our fact sheet. At the Mental Health Association of Maryland, we have fantastic fact sheets. I put up at top, and I'm going to give Nicole this presentation so that she can send it out to you and you can have the direct link. But at the Mental Health Association of Maryland, we have lots of fact sheets that have been written to make people feel, I guess, less stigmatized and more comfortable with some of the topics that can be difficult to talk about. So there is stigma around loneliness. People wonder, well, if I feel lonely, does that mean I'm not worthy of friends? So we need to take a very soft approach when we're talking to people about that, because there are so many people who are feeling lonely, and our fact sheets are very good at helping people feel more comfortable with these subjects, and then also understand different ways that they can tackle those different subjects. So I wanted to make a little plug for our fact sheets. Brain essentials. So now I want to tell you some of, the questions are always, what can we do? And earlier I said that a lot of us are having a reasonable response to some unreasonable or unusual circumstances. There's nothing that you can do that is really going to be able to reach out and change what's chemically happening in the brain of people who are experiencing lots of changes and lots of distress. But there are things that we know that are brain healthy that you can be doing for yourself, that you can encourage your family members to do, and that certainly older adults need information about brain health. And many of them are very well versed in health, but these are not the kinds of things that they're getting necessarily in the doctor's office. Some of these are. So here are things that we can do, ways that we can be proactive. Number one, eating heart healthy. As we get older, our taste buds change, and the sugars and the sweets, they taste better. We want them. We say, damn it, I'm 80, I'm going to eat what I want, which is great as long as people understand that that might be why they want a nap later on. That may be why they can't think so clearly. Our brain needs nutrients now more than ever as we're getting older. So, and heart healthy, we know eating heart healthy is eating brain healthy. Water, as I said earlier, many people not experiencing that same level of hydration. Maybe sitting in a chair all day and not moving around and not thinking about the fact that they still need to be drinking enough water throughout the day. So carrying around a water bottle is a great idea because it gives you that visual cue to keep that up during the day. Now I have a picture up of exercise. And the pictures I have up are like people lifting weights and riding bikes and playing basketball and running and all of those things that I swear to God I never do. And actually I get stressed out when I see pictures like this about exercise. The point is not to be able to lift as much as you can. The point is to be able to get the oxygen and the blood flow that your brain needs. Our heart needs to pump, our brain needs oxygen, and these two factors are really vital. As we get older, if we're not moving around very much, we're not getting that same level of oxygen. Kids are on monkey bars, right? Even younger adults doing all the things that they're doing keeps that blood flow circulating, and they're taking in more oxygen. And it's easy for us as we get older to not breathe as deeply, right? Not get that same level of oxygen. So, and many of you probably know there's a lot of older people who cannot get their hands up over their head because maybe they have just lost those muscles because they're not using them. But getting their arms up over their head, I mean, this is something that I do sometimes when I remember when I'm watching commercials, is take that time to like get those arms up just to get the blood going through the brain. Now I have a picture up of a man sleeping, and sleep is so critical. And sleep is also something that can be really challenging as we get older, because as you know, sleep problems are really common. So difficulty falling asleep, difficulty staying asleep, and also feeling sleepy during the day. Sleep hygiene is something that is really important to try before trying any of those sleep medications that have the butterflies that tell people that they're going to get a good night's sleep. That can be a real slippery slope. They're supposed to be used infrequently for good reason. They can, the toxicity in some of those medications can have very serious consequences on the cognition and even the balance of an older person. So we want to encourage people to get a full night's sleep, but we also want to encourage them to take periods during the day to rest their brains. So even during the day, if you might be sitting in a chair and it looks like your brain is being quiet, but you can be sitting in a chair thinking and thinking and thinking and worrying and worrying and worrying about, do your family members have enough warm clothes for the winter that's coming? And the mental concern that is going through people's minds right now of, am I safe? Can I be with other people? So what I want to do with this picture right here is just say mental breaks, rest. You don't have to be sitting in the lotus position, but to try and give your mind a rest. And mindfulness, we are learning more and more about the significance of mindfulness in terms of mental wellness. So that is something to be encouraging, along with resiliency and coping skills. Now I have a picture up of some older adults together, hanging out around a computer, enjoying things. Yes, we would love for people to be able to socialize. We would really love that right now. But let's talk more about meaningful connection right now. So activities that are important, learning new things, mental stimulation, all right? These are things that we want to encourage, and it's a brain necessity for people to be actively engaged. And this last picture here I have is a picture of a rubber band. And to me, that just is a picture I like to think about when I'm talking about resiliency, because we are going to be stretched and pulled in all kinds of directions throughout our lives. But again, especially as we get older and experience lots of changes, we're being pulled and stretched. And we want to help people to remember that they need to be somewhat like a rubber band, in that they maintain their utility, that they still are that same person, that they can bounce back after they go through some big stretches in life. So resiliency is another brain essential. I'm going to quickly go through, because I'm realizing how long I've been talking, some resources. Hopefully you all know about the Pro Bono Counseling Project. If you don't, this is one of the best kept, hopefully not a secret, but it's a fantastic organization that provides counseling and therapy to people who are underinsured or uninsured. It is Pro Bono Counseling Project uses volunteers who are clinicians, therapists who are giving their time to help provide services, mental health services and support to people who otherwise may not have access to it. And so right now they have a warm line. And the warm line is because too many people wait too long before they call for help. So the warm line is just if you're feeling distressed, if you're just needing somebody to talk to, if you're feeling overwhelmed, if you're feeling some of that, holiday stuff, please call the warm line. So the number there is 443-608-9182. The Mental Health Association of Maryland, what I've put up now are a couple of pictures that are a little bit fuzzy. Sorry about that. We have a mental health and aging website, and it is called Older Adult Vibrant Minds. And the URL is www.mdaging, stands for Maryland Aging, mdaging.org. That's where you can find all kinds of information, including a PDF of this guidebook that I have pictured here on the right-hand side. Hopefully some of you have seen or used this guidebook. It's a biggie, it's like 90 pages, but it is ripe with all kinds of information having to do about behavioral health issues and stress and mental wellness and things people can be doing to take care of themselves. It has a whole section on caregiving. And throughout the whole guidebook are resources, local resources, national resources that people can turn to if they want more information or to do a deeper dive in any of the topics. And we give these out for free. So the phone number to call if you would like a guidebook sent to you is 443-901-1550. And if the phone doesn't get answered, you can just leave a message asking that a guidebook be sent to whatever address you give. And you can have them sent in quantities. If your business is working with older adults or their family members, I highly recommend that you ask for them to send you a box. They're heavy, but there's 25 guidebooks in that box, and you will certainly give them out to people who need to be hearing this information. I have thrown so many words at you today, and statistically, you're going to only remember a very small percentage of them. So this is why you want to have a guidebook like this that you can always pull out and reference. That, by the way, is my mother-in-law on her paddleboard, which is her favorite activity. And they live down at the beach in the summertime. And she is in that picture, she's in her late 70s. Well, she's now in her mid 80s and still doing that after all kinds of health, social, emotional, mental changes and challenges that she's had over the past years. So I want us to be able to communicate to older adults and to their family members that we can always keep our passion as our goals, right? And that maybe we can make some modifications to activities. We might need to do that, but to keep spirited, to try and stay vibrant. I really wish that this picture had a picture, showed her dog on the back of the paddleboard, because that's usually how it is. She's got her little dog on the back of the paddleboard. A lot of the things that I've talked about today are heavy and can be, indicative of burden, hardship, and distress. But for the most part, older adults do not experience mental health problems, right? So let's help people understand that the idea of things being downhill and the notion that it's normal to get depressed when you get older, these are myths. This is stigma. Let's help people keep as healthy as we possibly can. And that is the end of my presentation here. So I am going to stop sharing and see how much time we have left, or ask Nicole to give me a little time indicator here. Oh, there's
We have time left, and I did get a couple of questions in the chat. I think one got answered. That picture that had your mother on it was the cover of the book, correct?
Yes.
That's what the book looks like.
Yeah.
We did have a question from Julie Chamara about what activities do you do to build resilience? If there are some specifics, because I think that is something that's a newer terminology for a lot of people, but I think sometimes people are already doing activities that are engaging in building resilience.
Yeah, and I think my head right now, nothing spectacular is coming into my head. I will tell you, however, having done presentations on building resiliency skills, if you Google resiliency, you will not believe how many things come up. And there are courses and there are books and there are inexpensive ways for people to find out the kinds of ways and things that they can do that are more unique to build resiliency.
And I did see Ellen did just chat in that a gratitude list is actually really a great way to start. And it is it's an inexpensive way. It's something that anybody can do. So.
I'm really glad she brought that up too. Thank you, Ellen, because the gratitude list not only helps with resiliency, but it also helps with mindfulness. And it is a practice with science behind it, that if people spend just even 5 minutes a day making a gratitude list, it changes their outlook. It's fantastic.
That's wonderful. If anyone else has questions, please feel free to unmute and ask them, because we have some time left and there's just a wealth of information here.
I would also ask that, you all are coming from a community. I don't live in your community. You might know of some really fantastic support services. So maybe what you can do as we're talking is put into the chat any kind of mental health support groups or organizations or activities that you're aware of right now. I'll tell you that in Baltimore County, where I live and work, we have something called the Connections Project. And the Connections Project is something whereby we have trained volunteers. We have trained volunteers to make friendly calls to older adults who just want somebody to talk to. And I think that the Connections Project is gaining so much in its popularity because it's just such an easy thing to do, that people are starting to come from other communities. So I don't know if they will be taking referrals from other communities, and people can self-refer. But Casey, the woman who runs that program is Casey Saylor, and she can help you if you want to try and start something like this up in your county. She's got everything you need to try and figure out how to put that together. And I think that she would be very helpful in terms of training people too. It's the peer-to-peer. So we know that a lot of people benefit from just talking to other people who are sharing their same experiences. So to just even connect one older person with another older person, if they're not friends, but you put them on the phone together and you get them talking about things that they have in common, there is healing power in that.
That's great. And we did have a request for the information about Connections Project. So Ellen, when we send the follow-up information, and this presentation will include that in there.
I want to tell you that if you go to the to mdaging.org, that website, there is a header that says, it might even just say Connections Project, but it's one of the programs that we offer. And also on those programs that we offer, you'll see that we have something on Monday nights called Mind Your Mind Monday. And we have a solid group of 15 to 20 older adults that join us to learn a little bit about their brains and mental health, but then also to have time to share with each other.
Fantastic. Also, Barry Klein did chat in a couple of things. One was healthy diet for older adults includes getting enough plant-based fat for brain health. And that is, we do know, and you did speak to the idea of that diet is very important for adults older adults because their taste changes. And we find that a lot with dementia patients, that they don't eat because they don't taste. And so they're not interested. And then the other resources, here in Harford County specifically, the Harford Family Crisis Center is here and available, and really want to redirect people to there as needed. 1-800-NEXT-STEP is the number that she put into the chat. So please remember that that's a resource. And please feel free to unmute if you'd like. I don't necessarily need to talk. And Julie, did you have another?
Yeah.
Go for it.
So Kim, I have a question for you. Are you talking to like assisted living facilities and organizations? This was great information. We took my father out of an assisted living in July and brought him back home because his mental health. He's 95 and he lost a lot of weight. And of course, his health has declined. He's at that stage of life where, things are just, his health continues to decline. He has a lot of different health issues. But what we really saw was his lack of connection with his family just really impacted him. And he wasn't getting the basic things that you were talking about in Maslow's hierarchy. Bathing, eating, his mobility is very limited. So he couldn't get up and move unless somebody came in and moved him. So so my question to you is, are you able to educate these facilities that really just how important it is when family members are maybe not involved or not engaged, and what that means for that individual?
Mm-hmm. Yeah, so we were instrumental many years ago in getting education around mental health and mental wellness into the training for people who work in assisted living and nursing homes. But that's just training. We need to understand that these folks are often very distressed themselves by the circumstances. And so unfortunately, what seems to be happening is decisions that are made in the name of safety that are taking away from the needs that people have emotionally, spiritually, and mentally. And this is a really difficult balance that people are trying to strike right now. I know that a lot of folks in nursing homes are saying, please let us open our doors to family members more. Let's figure out a way that we can do this safely, because the residents are suffering enormously. And I forgot to add that this is not just emotionally and mentally that they are, but cognitively. We're seeing a huge decline in cognition among our older loved ones who are in congregate settings, which is ironic. They're in congregate settings completely isolated. Yeah, we're trying. And you know what? We send these guidebooks to assisted living and nursing homes. But if you know of places that don't have these books, please, we can send them. Let us know.
I'll give a shout out to Kim Murphy at Cottages at Perry Hall, who just got off the phone ordering her books for her.
Oh, good.
So I did have a question about when you were talking about going to, when people are going to the doctor, are you seeing any uptick? And as I know from the dementia perspective, we have a real struggle with mental health isn't always viewed as the routine part of primary care well checks. And we've been trying to work organizationally in driving that to be a more regular piece. But are you seeing any increase in people getting that as a regular part instead of having to bring up something which we know oftentimes, particularly older people, are remiss to do?
Well, our doctor's offices know that people who have a lot of stress, cognitive impairment, or mental health problems take a longer time than other people who have a sore arm or a mouth ulcer. And so there's not an incentive to really be having the providers talk and ask and bring up these kinds of things, to your point. However, there is a lot more science and, more importantly, monetary information that if our doctors, primary care providers, provide healthcare providers at all can provide more integrated care, that they are actually going to have healthier patients that are going to take less of their time overall. So what we are seeing, thankfully, are more primary care offices that are incorporating either care managers or mental health providers. So I would ask about that, because it's not like they're going to send out a flyer that suddenly says, hey, we've got this new care manager who's working with us. But in Maryland, we're really lucky because there's a financial incentive for our providers to be using that integrated care. And so that can be anything from having somebody who you can refer to counseling, to somebody that you learn may not be able to make healthy food for themselves, and the care manager can set them up with Meals on Wheels or whatever it might be to meet those social determinants of health.
Great, that's wonderful to hear, because we know that's a struggle, and we know, like you've spoken to, generationally, this is, older adults are not the ones who want to talk about how they're feeling and what's going on. Does anyone else have other questions? Oh, I'm sorry.
I want to say too that the majority of our providers have not had geriatric education. And so oftentimes our assumption is we go to the doctor knows these things. Well, not all of the doctors, believe me, know about polypharmacy and the impact of medications and putting people on too many medications. Nor do they understand that somebody with dementia can appear to be absolutely fine in a doctor's appointment. So we need to try and bring more geriatric education to the consumers so that they can start to ask those questions. You're right, an older adult is not going to probably walk in and tick off all of these risk factors that they have, or these symptoms that could indicate something like dementia or behavioral health problem. But an informed family member or friend can call the doctor's office ahead of time, understanding that they can't get information about their loved one, but they could say to the provider, here are some of the things that I've been seeing, using that concrete language that we have in the guidebook, so that they're given a little bit of a heads up when that person walks in to that appointment.
That's great. Any other questions? Go ahead, Noel, you can unmute.
Thank you. Good morning, everybody. Kim, thanks for the outstanding presentation and the resources. I'm just curious, are you familiar with Crystal Watkins, the Assistant Director at the Geriatric Psychiatry Outpatient Program at Shepherd Pratt? I only recently heard of her, but I don't know her or anything about her or her program. Any
I don't know about her. And one of the calls that we often get, because we take help calls, by the way, too. So you can send people to the Mental Health Association, that same number where you called for the guidebook. You can also refer people, because we have folks that try to connect them with resources. But a very common question is, who are the good practitioners? Where do people go for geriatric psychiatric care? And we got away from giving any kind of particular clinician, because we have people who have good and bad experiences. But you can, through the guidebook, actually you can Google now, geriatric providers. So if you're looking at any kind of psychiatric hospitalization or care, I really, really encourage you to make sure that it is a geriatric program. So Shepherd has one, Levendale has one, a lot of places do, and I would be remiss if I only suggested one. And by the way, some of the partial hospitalization programs, which means the person gets services during the day, they're doing it now via Zoom, and it's working. It's really working. So there's some silver linings in this. It can be very, very difficult to get somebody, an older person who's got a lot of maybe mobility issues, to a psychiatric treatment program. And we're finding that with Zoom, it's really working.
That's fantastic. Yeah, I think this, if nothing else, this whole pandemic has really sort of seen a shift in telehealth opportunities and ways that we can use it to ensure people actually are taking care of their health in a more consistent fashion. So,
Totally to the advantage of older people who, by the
Mhm.
way, prefer to have services in home if they have like therapy or counseling services. You know, it's a real hard sell for us to get older adults to go to the community mental health clinic. It just doesn't happen the way it needs to. So it's nice that services can come to them now.
well, let's hope that this positive piece then continues when we are all back to being able to be more connected.
And you know what, guys, this is true for all of us. This, I keep saying older adults, this is true for us and our families. We need to be looking at our own mental health right now. And I would completely encourage you to go to the, there's a website and it is Mental Health America. And Mental Health America has all kinds of self-screening that people can do with regards to anxiety, depression, stress, and trauma. And even though we're in month whatever of this pandemic, trauma is something we should be considering as an experience that many people are having right now.
All right. Are there any other questions, thoughts, issues, concerns that people would like to address? Everyone want to just come off mute for a moment and say hello, goodbye to one another? Kim, thank you so much for this information today. This is an amazing amount of information, and you're right, we'll probably all walk away and remember a quarter of it, but we will be sharing all of the information and links to the resources. So we will make sure that gets out there to everyone, and please share it out to your networks, because you know, we know with this kind of information, it's great to have. It's even better when we can move it forward beyond ourselves so that more people can access.
And please know that the mission of the Mental Health Association is to be giving talks like this. So if you want any kind of education program for your staff, for your faith community, for your community, we're available to give these kinds of talks.
That's great.
For free.
Quick question. When you say you're going to share this out, will this come to us at our email addresses you have, or do we have to go to the
Yes,
game
no,
site?
it'll come to you at your email addresses. In addition, I just figured out how I can link some of these resources on the GAIN Facebook page, and we will also see if we can do it on the LinkedIn. I will have to talk to Tracy, our expert, about
Sure.
that. But we will get these documents as PDFs with the links in them so that you guys have a repository where you can go for them, because that's what we're realizing is we really need to find a better way to take the resources that we are pulling together organizationally and share them out and have them be there accessible, because I know I get emailed things on a regular basis and they're somewhere in the download file 3 times, but I can never find them. So we'll make it as easy as possible to get this information, because it's too important not to share. And I'm going to throw it over to Tracy Barnett to share a little information real quick.
Good morning, everybody. Can you hear me okay? Okay, great. So wanted to give everyone a heads up. I'll be reaching out to each member throughout the year. I've already started actually a little bit early for member spotlights on social. So you will see a different member spotlight, preferably every week. It may be every other week, just sort of based on preferences. If you have a particular week that you want to be featured, a special month you want to be featured, maybe it's an anniversary date for your company and you want to celebrate that, just let me know, and I'm scheduling it throughout the year, putting it on my calendar. All I will need from you is a very brief narrative. You can make it fun if you'd like, and your company logo in a JPEG so that I can post it to Facebook and LinkedIn. So I will be reaching out again. So don't feel like you have to remind yourselves. You will hear from me directly to keep it easy. But I think this is a really fun way for us to support one another too. So when you see that post on social media, and so for example, Nikki's went up last week, I believe it was.
Yes.
So it's on LinkedIn and Facebook. And if you're willing, share that post. So that brings to light a little bit more information for our fellow members. And it's just a really fun, sort of easy virtual way to support one another. So again, if you have a special week or month coming up that you'd like to be featured, please let me know. Shoot me an email, call me, text, you know how to reach me. All right. Thank you, Nikki.
No problem. Anybody else have any upcoming info to share? I know we're heading into what will likely be a little bit of a lull time for some people on activities and events, but you remember starting in January, if you have things coming up that are educational events for the community or for other members of GAIN, please go ahead and email them to Susan, Goad, and Tracy. Again, just a reminder, if you have your any kind of flyers as PDF, as JPEGs or PNGs rather than a PDF, it makes it easier for us to go ahead and get them uploaded onto the system. And if you create events in Facebook or LinkedIn and you want to make GAIN a co-host, we can share those events out more easily. So remember that functionality as well. If you have questions about it, you can certainly reach out to Tracy or Susan, and they can help you with the social media marketing piece of things. Not my expertise. So with that, unless there are other questions or anyone would like to share anything else, I think that kind of wraps us up for today. Again, thank you all for joining us. I know it's not the same as meeting in person, but hopefully we've been able to provide some valuable content for all of you. And we will continue to do this. Again, January will be more of an informal networking opportunity. You will have to bring your own breakfast and coffee, but remember to bring your ugly sweater and a recipe. And then we are looking again to address issues like stress, self-care, as well as the mobility piece, the exercise, and the need for us to ensure that we and our seniors are moving. So we're looking to address those two topics. If you have a topic that you are interested in hearing about, please be sure to share it with me. We are looking for input from our members about what we are presenting to you. So reach out to me and we will do our best to get a speaker or to give you an opportunity to help us craft a session. And again, we're virtual through March. We will reevaluate as we move forward. But until January, I hope everyone has a wonderful holiday season and look forward to seeing you all again in January, if not before. Thank you again, Kim.
Thank you all.
Thanks, everybody. Happy holidays.
Happy holidays.
Merry Christmas.
Merry Christmas, everybody.
Merry Christmas.